President Obama will be giving a major address on health care to a joint session of Congress tonight. Here with his thoughts on what to expect and the impact of that speech is Dan Clifton, head of policy research at Strategas Research Partners. Good morning to you. A lot of lead time up to this speech tonight. Right. President Obama's potential remarks having been sliced and diced even before he's made them himself. Dan, what is it that you are going to be listening most specifically for this evening?
Yeah, I would be looking for a couple of issues. First, Obama needs to assert control over this debate. The public is against this bill. There's more people opposed to it than for it. So he's got to assert his leadership, and he's got to be clear in terms of what this exactly means for the average American. Most people are worried they're going to lose their own health insurance. Second, we would need to see him try and rally a lot of Democrats. He can pass this bill without one Republican vote. So he's got a Democratic problem. We got to see him reaching out to those moderate Democrats, and he'll do that by saying he supports a public plan, meaning a government-run system, but that it's not exactly essential for him signing this into law.
So you're saying he'll lean left, but not that far left. Public option, a desire, but not necessarily a necessity to getting his initiative.
That's correct. That's correct, Margaret. What we think we're going to see tonight is the beginning of the compromise. He'll leave himself a lot of wiggle room, and by saying that this is important but not essential, and that will set up what many people are talking about is a trigger that if in a couple of years there's not improvements in the managed care market, then maybe a trigger will kick in, and that will set the stage for a potential compromise on health care.
According to Gallup, 39% of Americans want their congressperson to vote against this legislation. 37% want this new legislation, whatever it's going to look like. So it seems like public opinion is rather thinly sliced. How do you sell this?
Well, that's absolutely correct. And I don't think that the legislative leadership in the House or Senate really fully understand how much the public is against it. In addition to the numbers that you just cited, that Gallup poll shows that the voters who are against it are much more intense than the voters who actually support it. We've seen a resurgence in the Republican Party, which was dead 4 months ago because of opposition to the health care. That's why Obama really needs to hit a home run tonight. Remember in July, Margaret, he did a press conference to re-energize the health care debate, and it fell flat on its face. If it falls flat this time around, I think health care reform may die or be scaled back very much significantly, and that's very positive for the stocks moving forward.
You say this is the beginning of the compromise tonight when President Obama addresses the nation and addresses Congress. If that's the case, then he's made the decision that health care isn't something he wants by any means necessary here. In the broader sort of chess game that is Washington politics, why has he made that decision? What other initiatives is he looking at that he has decided aren't worth putting at risk by pushing this through on solely a Democratic momentum?
That's right. Margaret, I think that's a great question. What we've seen is that President Obama's numbers have declined significantly because of health care as well as the Democratic Party. They need an exit strategy. They need to get some sort of accomplishment, which would be increased coverage. They could probably get 90 to 94% of Americans covered. That's a huge victory, but they need to move on to an issue such as financial regulation, which is going to have much greater resonance with the American voter, clamping down on Wall Street. And I think the one-year anniversary of Lehman Brothers provides that opportunity for them to stake that message. So they're trying to get health care done as soon as possible. It's still a very complicated piece of legislation, but essentially they're going to compromise because the 60 votes in the Senate are not there to do this more aggressive public plan proposal.
Is the president going to reach out from the podium this evening? Is he going to mention some of the senators by name, whether it's Baucus, who's put forward his own plan, or others?
Well, I think he has to, because Baucus is really trying to find a path forward. I think he's even going to include some of the more moderate Democrats, such as Ben Nelson from Nebraska, who's been trying to help him. Additionally, Margaret, I think what we're going to see tonight is a push for, or maybe some acknowledgement of some Republican ideas that they would like to see, such as medical malpractice. I would caution that Obama's not for caps on torts in terms of medical malpractice, but you're going to see an acknowledgement to it. The independent voters in this country, which were the base of the Democrats in 2006 and Obama's victory in 2008, have left this administration, and they got to figure out a way to get them back. So we'll see some outreach on some more conservative ideas as well.
We're looking before this segment at the drug makers themselves, those shares gaining ahead of this speech tonight. What does that indicate from your view?
Well, I think that the drug industry has done a very good job of getting out. They understood that there was going to be a reform proposal, and they did not want to have major cuts. So they got to the table. They said they would take some smaller cuts, but they want to be part of the process, and that's why those stocks are rallying. They're going to be protected by policymakers moving forward.
All right. Thanks so much, Jan Clifton of Strategas Research Partners.